Hi everyone, I'm here to present on the topic quid to rec and leaves to remedy. So we all know that betel, which is pepper betel nymph, belongs to the family Peppereaceae, which is often called as the green gold. It is also called as the golden heart of nature because it has the function of healing wounds in traditional Balinese medicine. And the habit of chewing fresh betel leaves along with areca nut, mineral, catechu and tobacco is known as ninan. So coming to its incidence, from all over the world, nearly 2 million people are regular users of betel quid and betel leaf. In India, more or less 15 to 20 million people have the habit of chewing betel leaves and betel quid regularly. So among them, the percentage of men using betel quid is 61.8% and women is 19.5%. So coming to its composition, it actually consists of proteins, amino acids, vitamins like A, B, C, and K, and minerals like magnesium, potassium, calcium, iron, iodine, phosphorus, and zinc, and also essential oils like eugenol, hydroxychabicol, allyl pyrrocatechol, quercetin, etc. These essential oils are very important because they are responsible for most of the properties of this extract. So let's see about the pathophysiology of how betel quid causes cancer. So this is due to the presence of areca nut, catechu, and slate lime, which actually has an abrasive effect, which causes local trauma as well as injury, as well as it causes DNA damage by increased levels of reactive oxygen species, causing cell proliferation and causing mutations. And all these can lead to a pre-malignant lesion like leukoplegia. And this arecanut also increases the oxidative stress due to the decreased levels of cellular glutathione and increased levels of reactive oxygen species. There is also increased the production of collagen and inhibition of the collagenase enzyme by arecanut. So there is more fibrinogenesis, which all leads to a pre-malignant condition like oral submucosal fibrosis. So all these leukoplegia, oral submucosal fibrosis, chronic inflammation, DNA damage, cell proliferations, mutations, and poor immunosurveillance all can cause oral squamous cell carcinoma. This is how betel quid causes cancer. We all know that betel quid chewers actually swallow the betel quid juice. So they are exposed to some chemicals called as nitrosamines. They include nitrosoguasin, nitrosoguacolin, methyl nitrosoaminopropionaldehyde, methyl nitrosoaminopropionitrile. So among these, methyl nitrosoaminopropionitrile is very carcinogenic, which is very important factor to cause oral cancer. So now let's see about the pathophysiology of how betel leaf cures cancer. So this is due to the presence of the essential oils like hydroxychabicol, which has the effects like anti-proliferative, anti-mutagenic, and anti-ulcerogenic, which leads to suppression of oral carcinoma and suppression of some other cancers, as well as suppression of gastric ulceration. And they also consist of chavi-betal, which has a radioprotectant effect, thereby contributing to anti-carcinogenic effect. And it also has eugenol, which has an anti-mutagenic effect, thereby giving an anti-hypercholesteric effect. And it also has a chlorogenic acid and alpha tocopherol, both of which are anti-cancerogenic in nature, and beta carotene, which helps in suppression of gastric ulceration. And coming to its uses, so these bioactive compounds are very much useful as antioxidants to prevent cancer, inflammation, and some other neurodegenerative disorders. So this extract has its effect as anti-mutagenic, anti-proliferative, anti-lipidemic, anti-glycemic, cardioprotective, which will be later explained in the upcoming slides. So they are also used for bacterial, protozoan, and fungal infections, and also for insect attacks. They can be used for cold, cough, bronchial asthma, stomacalgia, bad breaths, rheumatism, gum swelling, conjunctivitis, any some other abscess, injuries, cuts, and periodontal diseases. So now let's see how the extract from these betel leaves are prepared. These are prepared by a method called as solid method by using an apparatus called as solid extractor. So the solid sample, which are nothing but the dried betel leaves, are mixed with anhydrous sodium sulfate, and they are placed in an extraction thimble, and they are extracted using distilled water as solvent in this extractor. Then the extract is dried and 5 concentrations of this extract were prepared. Coming to its anti-proliferative effect, so according to the studies made by Devjani Banerjee and Barka Shah in 2013, it was said that this extract especially has an anti-proliferative effect on the human lung cancer cell line. This is due to the presence of fiber extract like petroleum ether extract and ethyl acetate extract. So this ethyl acetate extract especially has an isolated molecule called as eugenol, which is mainly responsible for this chemotherapeutic effect against cancer. And let's see about chemopreventive effect. So this nutraceuticals, beta leaf nutraceuticals, has target multiple cellular events which inhibit tumor growth as well as inflammation. They actually inhibit the tumor growth as well as inflammation by increasing the levels of ABCA1 and increasing the levels of liver X receptor, thereby inhibition of LDL oxidation. These are nothing but the detoxification enzymes, and they also increase the free radical scavenging. They decrease the inflammation by decreasing the levels of cyclooxygenase 1 and cyclooxygenase 2, and by decreasing lipid peroxidation. They decrease the tumor progression by increasing the levels of cleaved caspase 3 and cleaved PARP, thereby which induces apoptosis. So all of these factors actually lead to increased oxidative DNA damage of the cancer cells, thereby helps in killing of cancer cells. So this slide explains the relationship between reactive oxygen species and the chemopreventive effect. So reactive oxygen species are nothing but they are the highly reactive chemicals which are produced from water, oxygen and hydrogen peroxide. So these chemicals usually in a normal cell, these reactive oxygen species are in a very low state and the cellular levels of cellular glutathione are more. But in the case of cancer cells, the reactive oxygen species are present in a partial state beyond which they enters into threshold level. So, but these betel leaf nutraceuticals are the phytochemicals. They actually pushes the ROS levels beyond its threshold level, which actually induces apoptosis of those cancer cells, thus help in killing of cancer cells. And this also explains the same mechanism between the reactive oxygen species and the death. Now let's see how it helps in preventing cytokine storm in COVID-19. So these beta-leaf bioactive compounds, they actually act on tumor necrotizing factor alpha, interleukin-1 beta, interleukin-6, and NF-kappa B. And these bioactive compounds actually have low binding free energy and more affinity to these agents when compared to beta-glucan as well as thiopurine. So they can act as better controlled immunomodulatory agents. So usually in COVID-19 affected patients, the levels of interleukin 6 as well as some other cytokines are very elevated. So cytokine storm, which ultimately results in inflammatory response, respiratory failure, and mortality. So this beta leaf extraction compounds, they actually act as immunomodulatory agents and they prevented the cytokine storm. So the effects of cytokine storm like acute respiratory distress syndrome, multi-organ failure, hyperinflammation syndrome and ultimately death can be prevented by using this beta leaf extracts. And coming to its anti-cardiogenic effect, according to Dinesh MD et al. In 2016, the extracts of this pepper betel leaf actually exhibited an antimicrobial effect, especially against Streptococcus aureus and Streptococcus mutans. This is actually due to the presence of a component called stilbene, which will be synthesized by various green plants. Hence, this has an anti-cardiogenic effect. And it also has an anti-lipidemic effect because usually in hyperlipidemic patients, the excess lipids will accumulate inside the macrophages and leads to formation of foam cells, which are nothing but the lipid-laden macrophages. So this betel leaf extract actually prevents lipid accumulation in macrophages by increasing the metabolism of oxidized LDL, which is low density lipoprotein, by reverse cholesterol transport mechanism, by upregulation of ABCA1 and liver X receptor. So coming to its anti-diabetic effect, in patients with diabetes, usually the levels of serum blood glucose level will be higher due to insulin resistance. So in obese patients, the levels of fat is also higher, which will in turn break down to produce glucose molecules, which actually further increases the levels of serum blood glucose levels. So the levels of this glucose in the blood is very higher. This beta leaf extracts helps in downstreaming targeting of acetyl-CoA carboxylase and increased activity of AMPK. Therefore, it brings the blood glucose level to normal or decreases the blood glucose level. So this ability of this beta leaf extract was actually found to be 200 times very effective than metformin, which is a very common oral hypoglycemic drug. So I would like to conclude by saying that chewing betel leaf along with betel quid is actually very harm, which actually leads to many pre-malignant lesions and pre-malignant conditions and ultimately cancer. But chewing betel leaf alone is actually beneficial because the extracts of this betel leaf can be developed as drugs. So which actually helps in preventing cancer. So in future, further studies are required to investigate the isolation of leaf compounds which are responsible for this anti-cancer activity of this plant. So these are my references. Thank you.